Good morning, everybody. Here with Dr. Marion Gale, of course, the Deputy Chief Health Officer in New South Wales, and also Sarah Gill, who is the Acting Chief Executive of Breastscreen New South Wales. First of all, I'd just like to report that we had 863 locally acquired cases of COVID to 8 p.m. last night. That was out of a very substantial number of tests, 132,279 tests. And I thank the community again for coming out in such great numbers for testing, and we need to keep that up. Although we can see the end is getting closer, we're still in a situation where we need to be concerned about COVID across New South Wales, and definitely, if you've got any symptoms at all, go and get tested. Vaccination rates are doing very well in New South Wales. Right across New South Wales, we have 85.7% of the population over the age of 16 who have received a first dose of the vaccine, and 60.4% are fully vaccinated. So again, thank you to the community who understands the need to be vaccinated in a pandemic. The way out of this, the way to keep your family, the way to keep you, the way to keep our community safe is to go and get vaccinated. Sadly, we had 7 people pass away to 8 p.m. last night. There were 4 women and 3 men. On behalf of the government, on behalf of the community more broadly, and of course New South Wales Health, I extend my condolences to each one of those people's families and their friends. It's very tough when we have anyone that's close to us passes away, and these families would now be suffering that, so we're thinking of you. That takes us to 316 COVID-related deaths in New South Wales since the 16th of June. And I want to emphasise again, I hear conversations now that we don't need to get vaccinated. Well, yes, you do. You need to get vaccinated. You need to go and get vaccinated as quickly as possible. You're kidding yourself if you think you don't need to get vaccinated, because it may well be you that gets the virus and dies, or ends up in a hospital ICU. It may be you that passes on the virus to your family or your friends and sees the responsibility then fall upon your shoulders for the death of one of your close friends or family. You need to get vaccinated. Stop kidding yourself, you need to get vaccinated. As life gets a little better, I'm very pleased to say that one of the services I think that we were all very concerned had to be wound back to access more staff is now coming back online, and that is Breastscreen New South Wales. There is nothing more important than having Breastscreen services available for women to be able to make sure that they are addressing those concerns of cancer. And today, Sarah Gill, as I said, the Acting Chief Executive of the Cancer Institute, will give us some commentary about that. I want to also indicate some good news, some more good news, and that is that whilst we've currently got Byron, Shire and Tweed in lockdown, at the end of the 7-day period, each one of those areas will be coming out of lockdown. So thank you to the community in those 2 areas who have complied with the directions in regard to the lockdown, and thankfully we've had no further cases of concern, and so the public health team have advised that they can come out of lockdown. I should indicate though that the public health team is looking very closely at 3 areas that might have to be, or are being considered bluntly for lockdown, but there's still a little more work to do. But I'll get Dr. Gale to address those issues, but Port Macquarie is one of those areas. Kempsey might have an extension, and Muswellbrook is also being considered as a result of cases in those areas. So these decisions are not made lightly. There's more work to do, and the public health team will be doing that work this afternoon, but I'm just putting the community on notice that there may be a further announcement today in regard to all three of those areas, or any one of those three areas. We just need to make some final decisions on that. But in the meantime, my strong advice as Health Minister to all of the residents in those areas is to be very cautious where you're moving around at the moment, and to certainly go out and get vaccinated. What we do know, vaccinations work. Vaccinations keep people out of hospital and hopefully not dying. Obviously, if you've got other underlying health issues, that can still be a challenge, a big challenge. But essentially, vaccines are what is saving the world from this pandemic. So please go and get vaccinated as quickly as you can in those areas. I'll ask Dr. Gale to give us any more information, and then we'll ask Sarah McGill to make some commentary about the resumption of breast screening services in New South Wales.
Thank you very much, Minister, and good morning, everybody. In the 24 hours till 8 p.m. last night in New South Wales, we had 863 locally acquired cases of COVID-19 and 2 overseas acquired cases reported. As the Minister said, we continue to see very good, consistent testing rates, with over 130,000 COVID-19 tests reported till 8 p.m. last night. We're really pleased to see the vaccination rates continue to increase at the rate they are, and a big thank you to all of the community for taking up every opportunity to get vaccinated with the excellent vaccines that we have available to us. And a reminder to anybody who hasn't yet booked in for their first dose, or who hasn't yet got their second dose, to please do so, either through any of the New South Wales Health run clinics, your GPs, or a number of pharmacies as well that are available with COVID-19 vaccines. So a big thank you to everybody to their wonderful efforts. And as we've said before, we really think that New South Wales can lead the world in our vaccine coverage, and it's going to be such a critical part of our path going forward. So a big thank you, and I do urge anyone who hasn't taken it up to please do so as soon as you can. Currently in hospital, we have 1,155 COVID-19 cases admitted. 213 people are in intensive care, of whom 113 are requiring ventilation. Of the 213 people in ICU, 160 are not vaccinated, 45 have received 1 dose of a COVID vaccine, and 8 people have received 2 doses of a COVID-19 vaccine. As the Minister said, tragically today we announced the deaths of 7 people who have lost their lives to COVID-19, 4 women and 3 men. 1 person was in their 40s, 1 person in their 50s, 2 people in their 70s, 2 people in their 80s, and 1 person who was in their 90s. All of those individuals had underlying health conditions. 1 person was not vaccinated, 3 people had received 1 dose of a COVID vaccine, and 3 people had received 2 doses of a COVID vaccine. And we do know that a number of those individuals who were vaccinated unfortunately had just received their COVID-19 vaccination not long before acquiring their illness. So we know in a number of cases, unfortunately, the vaccine didn't have enough time to provide the protection that we would have wanted. 3 of those individuals who passed away were from Western Sydney, 2 were from southwestern Sydney, 1 person from northern Sydney, and 1 person was from Dubbo. That gentleman from Dubbo was in his 40s, and he passed away at Dubbo Base Hospital. He was not vaccinated and had underlying health conditions. 2 of the people who died that we're announcing today acquired their infections in hospital. A woman in her 90s from Western Sydney acquired her infection at Nepean Hospital, and a woman in her 70s acquired her infection at Campbelltown Hospital. So I'd like to extend my sympathies, my sincere condolences to the families and the friends of those 7 individuals who've passed away. And we acknowledge that every time we announce these deaths, there is tragic stories behind it, and families and friends who experience that pain. And so, again, I encourage everybody out there to follow the public health orders, to please get vaccinated. We know that vaccines are highly effective at preventing hospitalisations and death. And so if you haven't already done so, please do book in for your vaccination. Finally, just to make some comments on areas of concern, similar to the suburbs that we often draw attention to, and while we've seen some great improvements, particularly in the uptake of vaccinations, which is really terrific in these areas, and also some decreases in case numbers, we'd also like to still remind and ask the populations of the following suburbs to be extra vigilant, and they are people in Auburn, Punchbowl, Greenacre, Guildford, Bankstown, Penrith, Marylands and Blacktown. I'd also like to particularly encourage residents of Wellington in Western New South Wales to be vigilant for symptoms. Please come forward for testing. Please get vaccinated. We are seeing increased numbers in Wellington, so if you live in Wellington, please be vigilant. And finally, as the Minister said, we are watching and looking at the situation very carefully in Port Macquarie, Muswellbrook and Kempsey. And in all of those areas, we have had an increase in local cases and people who have been infectious in the community. So we are currently looking carefully at those situations and will be providing recommendations. So if you live in those areas, please be vigilant, come forward for testing. Thank you.
Good morning, everybody. As the Minister has said, I'm Sarah McGill and the Director of Breast Screen New South Wales. Breast Screen New South Wales provides free mammograms to women to detect breast cancers as early as possible, before they can be seen or felt. Women who come to breast screen have no symptoms of breast cancer, but come every 2 years to screen for signs of breast cancer. And as we know, that detecting it early means that you can have better health outcomes. Earlier in the pandemic, Breast Screen New South Wales made the very difficult decision to temporarily suspend screening. This decision was made in response to the increasing risk posed by the COVID-19 Delta strain and the need to redeploy staff to support the pandemic response at every local health district across the state. This extra effort included vaccination, testing, support for the specialty health accommodation and relieving the frontline workers who needed to quarantine. I'm really pleased to advise today that we are now working towards resuming services across the state on a case-by-case, site-by-site location, according to the level of risk and operational considerations posed by the COVID-19 Delta strain in every area. As the Minister has announced, we currently have a number of services in the Mid-North Coast, North Coast and Hunter New England local health districts already screening women, and we're working with other local health districts across the state to plan for reopening of services as soon as possible. The services that are now open include Coffs Harbour, Lismore, Port Macquarie, Tamworth, Narrabri, Scone, and we have mobile services in Kyogle, Casino and Grafton. Our priority with all services will be to rebook women as soon as we possibly can. Women who have had the appointment cancelled due to the temporary suspension will be contacted by their local service and allocated a prioritised booking. Breast Screen New South Wales has implemented a range of COVID-19 safe measures at its clinics and mobile screening services to protect women, staff and the wider community. It's really important to note that Breast Screen is a screening program for women with no symptoms. Women with symptoms of breast cancer should see their doctor as quickly as possible These symptoms include a lump, changes to the breast, dimpling of the skin, and any other changes in breast tissue that might not be normal for individual women. And we really need to impress on women, as we've been saying throughout the short-term suspension, if they have concerns about their breast or any changes to their breast, that they should get checked as a matter of urgency. We're really looking forward to welcoming women back to breast screen services. The staff are really keen to ensure that services are available as soon as possible and working with their local health district to do so. So we look forward to that over the coming weeks and months as services are able to open. Thank you.
Minister, can we start by asking about these 2 deaths in New South Wales Hospital? What can you tell us about the details behind that? 2 people go to hospital, catch COVID and die. Obviously extremely serious. Is there fault? Is there liability? Is there compensation, apart from the apologies that you've offered today?
Across the world, it is well understood that in a pandemic, there are always going to be risks for individuals no matter where they are. Hospitals, by definition, have people who come to them with COVID, and so there is always going to be that risk. But on the whole, if one looks at those risk factors, clearly anybody who has any illnesses or any problems that require going to hospital should still go to hospital. It's been discussed many, many times. I'll find out whether Dr. Gale would like to add anything to that.
So I can say for the person who passed away, who acquired their infection at Nepean Hospital, that transmission is being actively looked into at the present time. We are aware across all hospitals in New South Wales we have patients with COVID who are admitted, and so how that person acquired the infection in hospital is being actively looked into and investigated at the current time. In relation to Campbelltown, we are aware that there are currently 17 patients who are infected in Campbelltown Hospital and 3 staff, and 1 death associated with that cluster at Campbelltown Hospital. And what we understand is that the index case, or the initial positive person, was transferred from Liverpool Hospital, where they acquired their infection. So as the Minister said, in the context of a pandemic with a number of cases in the community, we know that our healthcare facilities are vulnerable to introductions of COVID, and that's why we have such an intense focus on vaccination of staff, of infection control procedures, of screening of visitors, screening of patients, screening of staff. And a really important thing that as a community we can do is to really get vaccinated so that we can protect our health system. But that's going to be an ongoing risk in Australia, as it is globally, to keep our healthcare facilities safe.
In relation to this breast screen announcement.
Sorry, just on that issue, can I just finish by saying that clearly when any of us have our family members going to hospital, we want them to be well cared for, and it's awfully sad, it's terrible when somebody gets COVID in a hospital setting. And to the families of those people, I'd just say, our thoughts are with you. But we also do have to understand that in a pandemic, right across the world, hospitals are the places where people come with COVID. So there's always a risk with this Delta variant that it might be present. The hospitals do everything possible across New South Wales and across Australia. I know all of my ministerial colleagues, Labor and Liberal around the country, all suffer great anguish when we hear of patients who have contracted the virus in a hospital, and also passed away. But at the end of the day, that should not deter others from coming to hospital, because if you are having a heart attack or a stroke or some other immediately life-threatening illness, the place to be is a hospital, because obviously you're not going to be doing too well if you're by yourself. The odds of getting the virus in a hospital are still very, very small, and we do need to keep that in mind. I also think I need to just emphasise that it's very, very difficult with this particular virus, we've talked about this for many, many months. You can be infectious without even having symptoms. And so people can enter the hospital in all innocence to seek help. Staff can enter as well, but they can be, in fact, contagious. So it's an awful situation. It's just terrible. And again, my sympathies to the families. It's an awful situation, but it's what the world has been dealt with this Delta virus. Sorry, go to James first. That's all right. I'll come to you.
Hospitalisations are tracking a little bit under what you expected in terms of what got jumped yesterday. Now we've got breast screen coming back. We still haven't hit the peak, according to that Burnett model, of hospitalisations in ICU. Are you still expecting the ICU demand to peak in mid-October around that 947 mark where it was, or is it looking better than what was initially projected?
I think the first thing to say is that modelling depends on the inputs. And the modellers, the expert epidemiologists that put together these models, look at a variety of data and determine what data they're going to put into their models. I very well remember in about March or April last year being in the health building and having a model put to me based on data input, which was the only real data available at the time, from Europe. And the forecast was that in New South Wales we would have 25,000 people die by Christmas last year. I think that emphasises that modelling has a place, but it also needs to be considered in the context of what data is available, what data is going in, what are the inputs. And of course, the one thing that we know is that our community in New South Wales is leading the country in terms of being prepared to go and get vaccinated. So those vaccinations are making a difference to the modelling. And I think what we're seeing now is at least a hope that we may not get as much pressure as we thought on our hospital system. But that's by no means clear yet, James. I think the approach that I have as Health Minister, and certainly with the senior health staff, is we're still taking a precautionary approach. We have to expect, but hope that it doesn't happen, that the numbers will increase again over the next month. We're hoping it doesn't happen. Ursula.
Minister, there's a lot of anger at regional areas that currently aren't in lockdown, that they're going to have those restrictions imposed upon them when we hit 70%, so October 11th. Why was that decision made? And do you understand that there's a lot of anger because they say that they haven't had the supply that they need, so they've been left behind, that they're going to be punished?
Every part of New South Wales, every community needs to understand there's only one path out of this, and that is vaccinations. And as we have made those decisions about how we try to bring our entire state out, there have been some difficult decisions. And I think the community need to understand that nothing is perfect in a pandemic. It never has been. The decisions that have been made in the best interest of the bulk of the community, the majority of the community. And certainly the crisis cabinet and the public health units that gave us the advice looked at all those issues. Sorry, I'll go to you first and then you, Lucy. Yeah.
Since the roadmap was released yesterday, Minister, there's been a lot of spirited commentary, in particular around the decision to announce when unvaccinated people will be able to join the party, so to speak. What's your thoughts around that commentary?
Look, I've stood in these press conferences now more than 500 times, and what I remember very well is that one part of the room will be arguing one thing, one part of the room will be arguing the other. You've got to expect that reflects the community. Journalists reflect the community. The community have a variety of views. But at the end of the day, the decisions that the government has taken right along, and I might add, I think each of the other governments, whilst we may not always agree with them, the governments around the country have done their very best to try and make decisions to balance the interests of the community. Nothing's going to be perfect, but everybody makes those decisions in their own jurisdiction. We've made ours, and we're sticking to it.
Minister, just further to Ursula's question on the regions. So as to supply, what do you say to those areas that still say they haven't had the same access to vaccine and are still struggling to find jabs in the same way that perhaps we've had it in the metropolitan area?
Look, I have sympathy with that view because we have had, as each one of you know, I don't think there's a journalist in the room who hasn't been at probably a couple of hundred of these press conferences at least. And one of the frustrations has always been the challenge to get vaccine available from overseas providers. The federal government has done their best, in my view, but it has been a challenge and it's remained a challenge. But right now, there is more vaccine available in this country than we could have probably dreamed of, actually, and more access across New South Wales than we had dared dream of only a few months ago. Pharmacists all across the state have Moderna. There's Pfizer available through the hubs and through some GPs. There's AstraZeneca that's been available for a long while. I think that in some areas there have been some challenges of getting the vaccines, but there have generally been availability of at least one of the vaccines. But there's been a little bit of pickiness and choosiness about that. I think in the way that I would encourage the community just to understand that when you're going to have your flu shot, you don't ask what brand it is, we never have. Just go and have the vaccine that's available, because whatever vaccine is available is the best vaccine that is going to keep you safe.
Minister, just on the December 1 day, by putting a date,
Yes.
have we lost people? Have we had cancellations overnight of people who might have booked in and thought, you know what, if I'm going to get the same freedoms anyway, I'm going to cancel my booking?
I think that what needs to be remembered is that there are many, many businesses who will actually be making it very clear that as at December 1, if you haven't been vaccinated, you won't be welcome. And I think the airlines have made that very clear. There are a lot of other businesses who are saying the same thing. And I think people need to understand that a balancing act had to be struck. But at the end of the day, if you haven't been vaccinated by 1 December, you're going to find that you still will have a lot more limited opportunities in the places you want to go. So really, just go and get vaccinated and stop hesitating, stop finding reasons not to do it. There's only one basic reason why you shouldn't be getting vaccinated, and that is if you have a medical contraindication. If you don't have that, you should be getting vaccinated. Sorry.
In terms of the police commissioner said today that he doesn't think it's the responsibility of his officers to police vaccination status. So what's the point of having strict rules if it's not going to be enforced?
Their rules have been enforced. They continue to be enforced. I haven't heard the police commissioner's comments. But if the law says that you have to be double vaccinated, then of course the police will enforce that. They have no choice but to enforce that. And they have done a remarkable job to date enforcing it. It's been a balancing act for them too. I mean, if you think about the fact that in the last 100 years, police officers really haven't had to go out and deal with health orders. In fact, thankfully, none of us have had to, with the exception of one rare moment. But basically, this is a new event, once in 100 years. I think our police have done a remarkable job trying to find the balance. And you know, you could pick on individual cases and say, well, they could have done it this way or that way. But overall, I thank the police for the work they've done. And I'm sure that they will enforce the public health orders as required.
They did say, though, that there would be no flying squads heading into restaurants to double check that.
Well, that's a different issue, Liz. That's a different issue.
Sorry, but it is going to be left up to the businesses individually. Are you concerned that businesses are being put in a position where this isn't going to stand up and that they will have to have individual arguments and end up calling the police anyway?
People who are doubly vaccinated, of course, have certain rights laid down under the roadmap for it. People who are not doubly vaccinated will not have those rights, and particularly in relation to hospitality for a long while. And that's by government order. In addition, businesses will be able to make their own decision whether they want to have the risk of having people in their property when they're not vaccinated. So I'm quite confident that in terms of enforcement of the law, the police will enforce those orders.
But the minister,
James.
The minister has said that the cops
Which
aren't-
minister, sorry?
Sorry, the commissioner, rather. The commissioner has said that the cops aren't going to be checking on help businesses to enforce them, but you're still going to have the publicans having argued with an anti-vaccine against the pub. Are you not worried about that?
I'm quite confident that the orders, any laws will be enforced by the police. It's their job. So they will actually do their job, and I'm sure the Commissioner will make sure that they do.
And how do you envisage businesses?
But can I say also, I mean, this is the sort of minutiae or detail that seems to preoccupy some sections of the community, and particularly journalists. But hang on, James, I'm talking at the moment. Just let me finish, please. And what I would say is that the bottom line is we all have an obligation. Each one of us have an obligation to our fellows, to the rest of our community, to be safe and to not spread the disease. It is quite simple. Go and get vaccinated.
But Minister, there's also...
Sorry, I think Liz or was
I'm
it?
just going to say, you know, it is a huge concern for business owners though. If I run a cafe and I'm going to come up against someone, you know, some person that doesn't want to be vaccinated, what am I going to do to stop them if the police are saying that they won't even enforce it?
Yeah, but I've answered that I think that the police will enforce it if the person is not actually doing what they should be doing under the public health orders.
It's not a great position for a business owner to be in though. Are you concerned about that? Do you...
Of course I'm concerned, but I'm telling you that if there are public health orders, it's a crime not to comply. So the police will enforce those orders.
You're not concerned. The issue being though that the Commissioner has said from October 11 we won't be going through and checking. Given that you're
but there are other methods of checking. We've had other enforcement, liquor and gaming and so on, have been out enforcing those issues all the way along the line. I don't think the police should be at the forefront of this at all. I think the police are more likely to be called in to actually deal with situations that will need to be dealt with. And that's an entirely normal occurrence.
Will a business be fined, Minister? Will a business be fined if someone who is unvaccinated that comes into their premises?
At this stage, that's not part of the public health orders, so I don't think that is likely. But look, everything is under review.
What will be the punishment for an individual who is unvaccinated going into a venue, and the punishment for the venue allowing that to happen?
The fine, I just said that the venue is unlikely at this point to be fined. That's not on the agenda at this point. And I don't think any state or territory are moving in that direction at the present time. But individuals are up for fines from somewhere between $1,000 and potentially $11,000 and or 6 months in jail if they breach the orders. If they go to court, that's the potential fine.
If the business is not going to be fined, then why would they have a fight with someone who is unvaccinated?
Well, James,
It's not going to be.
because if you're a business and you're doing your job to make sure that somebody's coming in who is actually complying with the law, then I'm sure they do that for their patrons to make sure all their patrons stay safe.
Minister, just on to the vaccine mandate for health workers that kicks in on Thursday. Is it looking like you are going to have to provide any sort of exemptions or broad extensions for local health districts where they don't have a sufficient health worker vaccination status yet in time for Thursday?
Look, overall, I think we're up to about 94% of first vaccines for the health workers across the state. They've really responded amazingly well, as you'd expect, because health workers understand the need to protect their colleagues that they work with. They understand that their obligation is to protect their patients, and they have been amazing. And I want to thank all our health workers who've not only been keeping us safe during the pandemic, but have also gone out in great numbers to get vaccinated.
Yes,
so,
in some areas like
hang on, Lucy, please. Let me finish. If there are individual small areas that have particular challenges, they need to understand, that is the individuals involved, that they also have that obligation. They have the obligation to their staff, to their colleagues, they have an obligation to their patients, and they should go and get vaccinated. This is no time to be precious or selfish. Get vaccinated. Hang on, can I just finish answering Lucy's question a second? And let me make it very clear that those orders are there for a reason, and if there are challenges in individual areas, then we will address those challenges, but it won't be with those staff who are causing the problems. It'll be with part of the network of our system. It's a vast system. It's the biggest health system in the country by a long shot, 140,000 staff. And if individuals don't want to be there, if they want to put their patients and their colleagues at risk, well, they won't have a position.
Minister, what's the plan going forward on the disaster payments for businesses who've been receiving those payments throughout this pandemic? What will happen once we hit 8%? Will they still be entitled to receive those? Do you know any details?
You'll have to address that issue to my Treasurer colleague when he's available, because that's not an issue that I'm directly involved in.
Minister, if I could ask,
So, yeah.
when is Parliament going to be returning? Is that at 80%? And also, protests, is that from December 1? Is that when they'll be allowed to return?
let's deal with Parliament. Parliament, I think the discussions are taking place at the moment. The last I heard was it was likely to commence, I think it's in the second week of October. And I think the Speaker and the various committees that are looking at that are trying to ensure that all the MPs who return are there vaccinated and in lesser numbers than normal, obviously, because of the general requirement more broadly that is part of what you've all seen with the 4 square metre rule.
What's happening
James.
with rapid antigen tests? They'll be allowed in the home from November 1, Minister, your counterpart has said. What's New South Wales?
The Federal Minister?
Yes, the Federal Minister.
Mm-hmm.
How is New South Wales going to use rapid antigen tests? Where are they going to be used? How are you going to collect the results? What's going to happen there?
Look, those announcements have only just recently come from the federal government, and obviously the issue has been around the TGA's view that the limits have been around the fact that the rapid antigen testing had to be done under clinical supervision. That's been something which has been somewhat of an annoyance and getting in the way of a practical usage of those rapid antigen tests in a range of circumstances. In overseas jurisdictions, rapid antigen tests are used much more freely. Now that it would appear that we are going to have a more free approach to the use of those rapid antigen testing, the government and the crisis cabinet will be able to make decisions about that after we get appropriate appropriate medical advice. Please one at a time. It's not as if I'm not rushing away. Just one at a time. Yes, I'll come back to you, Liz. Yep.
Just back to my question about protests. Are they going to be allowed to resume in December?
Look, I think the issue will be considered by the government, but I don't think there's any one of us on either side of politics who are anti the democratic process. Most of us respect and understand the democratic process, provided it's done in a peaceful way, which is not what we saw in Victoria, of course, and would like to see the opportunity for people to be able to make their applications in the usual way to the police and to have approval for democratic expression of your viewpoint. It's likely that one would think that when we get to the period where unvaccinated people will be able to have certain entitlements, that it would be, but it hasn't been determined yet. Liz.
The last 2 days has been, we've been on par virtually with Victoria in terms of case numbers. Is it now time to remove all, travel restrictions that we've got on the Victorian border and just let the 2 states flow freely?
Well, New South Wales, as you'd know, has never... let me finish. Have never put in restrictions except when things got really challenging in Victoria. But at the moment, obviously, there are certain aspects as a result of the Victorian situation that are driven by the Victorian government. I think we just need to understand a little more, or not we, but the Victorian government needs to understand a little more of how that's being managed before any decisions are made by the Victorian government. But I can't tell you what the Victorian government will or won't do. But as I've said many times, I respect their view, their position. They're doing what they consider to be appropriate, and we'll hear from them in due course.
So the vaccination rates in the east of the city are substantially lower than the rest of the state's average at the moment. What's causing that disparity, and what are we doing to fix that?
Look, there are pockets, obviously, where there are less take-up in vaccines, not just in the eastern part of Sydney, but other parts as well. And the availability of vaccines is certainly one of the issues we talked about before. But the health team have done everything they can to get the messages out to each of these communities to try and ensure they understand the need to be vaccinated. They've obviously ensured that there are, in addition to the GPs, there are pharmacists who are available with vaccines, try to make that as readily available as possible. In some areas what we've found is that there's people who perhaps don't have access to public transport and can't get to these various venues. So when we do that, there's been a lot of pop-ups and there's a whole range of activities that are currently being undertaken by New South Wales Health to try and encourage people in all of those areas.
So
Lucy.
Terry Chand yesterday said that you were still at the drawing board on aged care visits, but one of the things she sort of floated was perhaps keeping unvaccinated children under the age of 12 out of facilities maybe. Can you talk us through where your heads are at on aged care visits and the settings that are going to be required?
Yeah, as I think I said a couple of days ago, that I think each of us share the view that we should be able to visit our aged care relatives and friends in aged care facilities as soon as it is safe to do so. And the challenge is, how do we do that? Certainly, I know there have been discussions as late as this morning between our senior health officials and federal officials about how we might achieve an agreed position between the federal government and the state government. But I can indicate that certainly from the New South Wales point of view, we want to move as quickly as possible to get visitors back into aged care facilities where it is safe to do so. It may be that, and there's no guarantee on this at this point, but we're talking about the possibility anyway of, at the same time as 5 visitors can come into our own homes, that aged care facilities might be on the same time frame, because obviously that's people's homes. So whether or not it's 5 people, it'll probably be far less than that at that stage. But we're working through those issues between the Commonwealth and the state and trying to come up with an agreed arrangement. Dr. Chant's concern about young children, of course, is that youngsters 12 and under can't be vaccinated. And so if the requirement were that someone coming into an aged care facility was doubly vaccinated, which it will be, it definitely will be when that decision is made, there's no doubt about that one, then it presents challenges for youngsters coming in. So what Dr. Chant and her team are looking at currently are what other measures that might be something the Commonwealth and the states could agree on. That could involve, for example, children being outside, having outside visits. But even that presents some difficulties because some older folks in aged care facilities can't get out of the facility into, say, the garden area. So all those issues are being talked through at the present time, as you'd expect us to do, but it's with a great deal of passion and energy because we all want to have visits back into aged care facilities as soon as possible.
Can I ask a bit more clarity on
James.
RAT tests?
Yeah.
So when they are used in home settings, is the New South Wales government still of the view that you want to record every single test, or when they're used just as broad surveillance tool in the home, not under supervision, will we not... It
depends on the purpose, James, but as my voice is starting to get a bit anxious, I can hear, I'm in the sense of my throat, I'm going to ask Dr. Gale to answer something just for a second while I have, if I can find a glass of water, I will. Dr. Gale. No, I can't.
Yeah, so I guess I was asking, like, would New South Wales be happy to not have every single test result reported, maybe miss a couple of positive tests when we're at that stage where we're using RAT tests?
Yeah, thank you. Look, I think with the announcement that RAT tests are going to be more broadly available and available for home testing, we welcome that. I think, you know, it's clearly great to have more tools in the toolkit about options for testing, and we'll be looking at the best ways to deploy that new modality that's going to be can be used more flexibly. And the issue of how to report those tests will also be part of those considerations. I think we have to be practical, that if they're going to be tests that are available to be purchased by individuals and potentially by, you know, available in the home, that may be operationally challenging about how we're going to actually get the results for all of those things. So we'll be looking at those issues and looking at what practical settings actually make sense as we go forward in a setting where we have to treat COVID like an endemic disease, more like flu, more like other respiratory conditions into the future. So those are all issues that we'll be looking at and thinking around how we can best use rapid antigen testing with the new conditions around it as part of a toolkit of a number of other measures to make sure that we are looking to test the right group of patients or people in the right settings at the right time. Thank you.
Thanks, everyone.
So can I just ask a question to Sarah?
Sarah, you've got to come forward.
Great news that the breast screening operation is coming back in a phased way, but can you give us any indication of what your fears were for when it was closed down? How many patients that might have slipped through the net, through the cracks and not been discovered? How many potential cases we have, potentially even deaths we've had in that period?
Thank you for that question. It's a very good question. I think the service was very concerned and didn't make the decision to close services lightly. As you'll be aware, we closed services for a short period of time when the pandemic started last year, and we've been looking very closely at what occurred at that point. And we're very pleased to report there was very little impact from the closure of service at that stage. And women returned very quickly and promptly to breast screen services, which we were really thrilled about. So we're expecting the same thing to happen this time as services open, and staff and women will be safe to return. We expect that women will come back very quickly.
Good news.
Thank you.
Thanks very much. Thank you. Thanks to you.